Okay. So we have Dr. Leslie Hoglund with us, and I think that I know a lot of the people that are here, and they've probably had you for a class. If not, Dr. Hoglund's awesome, and she's recently taken over for the MPH program. We're super excited to hear what she has to say. Dr. Leslie Hoglund is a clinical assistant professor in the School of Community and Environmental Health at Old Dominion University. She's the program director of the Master of Public Health degree. Prior to joining the faculty in January 2020, she worked for 21 years as a public health practitioner at the international, national, state, and local levels with positions at the Virginia Department of Health, Physicians for Peace, Horizon Behavioral Health, American Cancer Society, Maryland Department of Health, and the National Institutes of Health. Dr. Hoglund inspires individuals, communities, and organizations to succeed through data-informed, culturally relevant, evidence-based policy, system, and environmental strategies that improve quality and length of life. She was selected by the Robert Wood Johnson Foundation as a 2020 Cultural Health Leader, and her community-based research focuses on how to reimagine the food environment to create food secure communities to improve health outcomes. Dr. Hoglund has her PhD, a Master of Education, and she is a Master Certified Health Education Specialist. I had to look those things up because I didn't know what all the things after your name meant. So super exciting, super qualified. We're really excited to hear what you have to say, and hopefully we have some time at the end when you're done. I have some questions, and I'm sure some of the people who've come have some questions for you. So I will let you take over.
Thank you, Sam. I really appreciate the opportunity to kick off the public health talks for the Public Health Student Association this year. I thought it would be really cool just to share a little bit more about my background and just kind of how I got here to this position. So bear with me a moment.
And thank you for joining us and doing this, because I think it's a great start to our public health talks.
Yeah, absolutely. I have to find the right tab. Okay, there we go. All right. So I did not start out as an academic. I found academia, I'll say. So my trajectory to this position is very atypical for most professors and program directors. So as Sam mentioned in my bio, I have had public health career experience at the local, state, national, international level. These are just some of the entities that I have had the pleasure to work with or work for or consult with, and have really led me to where I am today. So I love that public health is so eclectic, and really whatever your skills or interests are, you can pursue really anything within the field of public health. So if you're really good at writing, really good at speaking, public health departments need public information officers. We need people writing and submitting abstracts to conferences and writing manuscripts to journals. If you love interacting with people, we need health educators and community health workers, and those that are going to go into community, be with community, and help them to thrive. We need leaders, we need administrators, we need managers in public health, and even more so, I think we need new thinking around our public health. So I can certainly make these slides available, but I have linked some of my experiences here. So when you click on the international link, it'll take you to a photo album of a surgical program evaluation that I conducted in Blantyre, Malawi, back in 2015. So I've really seen a lot in my career. And in 2019, I got kind of bored with what I was doing. And I was like, what else is out there? And so that's ultimately what led me to ODU serendipitously right before the pandemic. So I in 2011, 2012, I helped establish the Lynchburg Area Food Council, which that's really what started my passion and my love for food security and food equity as my research sort of portfolio. I've been involved with the American Public Health Association, gosh, now probably going on close to 15 years as an active presenter at various annual meetings or moderators of sessions. I have done umpteen community health assessments and health improvement planning processes in local and state level efforts. And personally, I am an athlete ambassador and advocate with the National Down Syndrome Society, and I served on the board for the Hearing Improvement Kids Endowment Fund for about 8 years. So I've kind of had my hand in quite a number of things through the years, but I have since turned my focus really to looking at food security. I like to say, instead of having 6,500 food deserts, quote unquote, food deserts in America, why don't we have 100% food secure communities? You know, we all have the right to vote. We all have the right to marry who we love. Why don't we have the right to have adequate access to food? Just crazy to me. So that's what I work for. That's what I advocate for. That's what I research. And there's a lot coming because while the slide is really grainy, I'm developing a model of how to help communities get there and to do this through a process called salutogenesis, the origins of health, what creates and generates health and well-being. So there will be more to come because I want all of you as students to get involved with this and help move that along. But this is me and my family. I have 5 kids, and my oldest is 20. He attends the University of Maryland. He's currently in a 4+1 program, government and politics, and then his master's will be in applied political analytics. He's a little nerdy like me. And then Jasmine is in the navy blue shirt. She's almost 19. She has Down syndrome and alopecia. She was adopted from Hong Kong and came home in 2006 when she was about a year old. And then Joel is 18. He is in the solid blue shirt. He's also from Hong Kong, adopted with Down syndrome. Joel is also on the autism spectrum and has schizophrenia. So if you ever want to talk about the mental health world and having a child with a developmental disability, I can tell you some stories. And then Elise is 17. She just turned 17. She's a senior in high school. Jasmine and Joel are also seniors in high school as well. So in June next year, I will be having 3 high school graduates at the same time, which is really scary. But she is a great support to her siblings. We call them the non-biological triplets because they have done so much together. But Joel came home in 2011. He's been with us about 12 years. He was 5 years old when he came home. And then little Miles is 9. He is the bonus kid and decided he wanted to be a part of our family too. My husband is Todd. We've been married now for 23 years and life is fun at this point, having 3 adult children and 2 more on their way to becoming successful adults. But something that really motivated me was an article I read in 2005 by Olshansky and colleagues that talks about this current generation of children would not live as long as their parents in prior generations. And really seeing that happen now, about 18 years after this article was published, our life expectancies are going down considerably so because of COVID and other, the opioid epidemic and other public health crises. But this is really what motivated me to dig deeper and to go wider in public health. So like I said, I left public health formally in 2019. I was previously the division director of population health data in Richmond at the Virginia Department of Health, and was just really looking for some more freedoms, I guess, to research and explore things that I had questions about. And Taylor, for example, I'm really big on including students in that kind of learning, experiential learning. So in assuming the role of the MPH director, I'm trying to look for ways, using sort of design and systems thinking, how do we bake into the curriculum opportunities for experiential learning? So right now I am, and please feel free to come off mute and ask questions. And yeah, I just, if you feel like you have something you want to say or comment on, please feel free. This is supposed to be conversational. um, there's kind of four things that I am really determined to see come to fruition. One is having some kind of global health experience opportunity, not that you have to do it, but that there's an opportunity to go on some kind of global health experience. Secondly, that you are able to engage some kind of campus-based or community-based project or research or innovation. Third, that you have a governmental public health experience, whether that be like a site visit or a field trip to both a local, state, and federal level health agency. And then the last thing is being able to successfully secure a practicum placement in a field that you are interested in learning more about. So expanding our network for where we can connect students all over the world for their practicum placements. So those are the kind of the four pillars that I'm looking to establish within the program over the next year or two. Obviously, there's a lot of planning involved in things like that. We are engaged with a company called EF Tours. They do a lot in the primary, secondary school like type of learning trips, but they also engage colleges and universities. And so we're looking at pulling a trip together to the Dominican Republic, where we'll be in Santo Domingo. It will be about an 8-day trip, and potentially looking at offering this in conjunction with MPH 776 Global Health in the summer of 2024. So I'll pause there. Does anybody have questions about the global health opportunity and how that might work?
I was going to wait and see if anybody else wanted to talk first. So I'm sure I talked to you about this, but I did a study abroad trip for global health with the nursing program, which like that was our first year opening it up to other programs, but I was only public health student and everyone else was nurses. So they didn't really have anything that was catered around me. And so I just
The Ireland trip?
yeah. So I just kind of like tried to figure out what I wanted to like find out on my own. Like, I would inquire about like, their health systems and like what, if their water was fluoridated or, just like random stuff while I was there that they had no interest in. Not that they were like, what are you doing? But it was like they had their own, like, they're like taking blood pressure and stuff. And, so I'm curious, like, what sort of stuff you guys will be doing there, just that people might want to know about. And my second question was for us that might be graduating. Will you open it up as well to like other graduate students besides just the global health class?
Yeah, so that's a great question. I'll answer that first. Yes. So the way EF Tours works is it's open. We need a minimum of 15 people to go on the trip to make the trip run. So that's really open to other faculty members, to other degree seeking students or non-degree seeking students. The whole point, this will have a maternal and child health slant to it. We'll be meeting with various levels within the community, going into the barrios, seeing how certain programs work for prenatal care. We'll be going to the Ministry of Health and talking to more government officials and just finding out a lot about their programs and how they're enacting certain public health policies and systems approaches. There'll be a couple of days for some cultural immersion and experiences as well. I think the day before we depart, there's a beach day. So there's a little enjoyment built into the itinerary, but mostly it's seeing a different country's approach to public health from a maternal child health lens.
And would
So
there be any like epidemiological, maybe like surveillance or
potentially.
anything? Okay.
Yeah, I have. So when I worked for Physicians for Peace, I was the director of program evaluation. And so I have some connections there with some former partners that are always looking for people to come and help them evaluate what they do. So I'm working on some leads right now with potentially coming in and doing like a rapid epi assessment, not so much a full on program evaluation, but some preliminary assessment type data collection. So yeah, the idea is that whether you're a global environmental health track, health behavior, health promotion track, or the epidemiology track, that you would have a role and a place within the trip, that there would be a function to your attendance on the trip.
Thank you. And I just wanted to clarify that I wasn't speaking badly about the trip that I attended. I had a great time. It just,
Sure.
wasn't specific to what I was expecting for global health and interprofessional collaboration. So that's all. But thank you so much.
Yeah, absolutely. So that's the first trip that we're looking at pulling together. Secondarily, I don't know if it'll happen in 2024, but potentially looking at 2025, a trip to the Philippines to look at a vision care program, a community-based vision care program, and a community-based prosthetic program called Walking Freely. So Physicians for Peace Philippines would be the host organization, and then we would go out with them on their several kind of mission stops in the General Manila area. So that's kind of in the works right now as well. There would be opportunities for evaluation and assessment, definitely on that trip. And then third, looking at the National Health Service in the UK and the Public Health England, and taking a more public health approach to looking at those systems and how they operate. So that's all come about really because of connections I have in my network, my professional network, and then working with EF Tours. But totally open to ideas and other connections as well, as there's interest from students in, exploring other types of research or education in other places. So that's the global health part of it. Cost is estimated around $4,000, but that's an all-inclusive cost for flight, all the lodging, all the ground transportation, all the meals. It would cover everything except your like personal incidentals and souvenirs or, whatever you wanted to purchase. So.
Does that same company do any domestic trips? Like I'm thinking if anybody had a CDC connection, go for 5 days, maybe a cheaper option.
Not really. If we wanted to do a more like domestic trip. So something that I've been talking to my colleagues at the Virginia Tech Center for Public Health and hi, Ivy. Yes. You are a CDC connection. I think we've been talking about an urban to rural kind of trip, if you will, as well as my colleagues at Radford Carilion, their public health program as well. So kind of the three of us working together on a kind of urban to rural type of something. Still in the very early stages of conversation. But that would be within Virginia. We'd go out to far Southwest. Their students would come to Norfolk kind of thing. So it'd be some reciprocal learning opportunities.
Is there any talks of like scholarships or reaching out to maybe like alumni to see if they want to make charitable donations or anything towards the trips?
Yeah, certainly. That's always an ask, or that's always something we can tap into. I think right now we're just trying to get logistics down and figuring out cost and who might be interested. Like I said, we need 15 people to go on the initial trip. And I sent out a survey that's open until this week or the end of this week. And I've had 8 students reply with high interest in the trip. So about halfway there. I'm hoping that we can maybe secure a few more interested folks. But yeah, I mean, there's always ways to fundraise or to ask, donations to offset the cost. We don't have money in our budget. I will say that, unfortunately.
I did, on the trip that I went on, I got a scholarship from, like, it was part of the program. I don't know
Yes.
if that's like a specific like per trip thing. Also, I just put the link to the survey that Dr. Hoglund was just talking about in the chat.
Thank you. Yeah, so that is run through our study abroad office at ODU. Ideally, I went through them to see about getting something set up, because I don't know if any of you were around in like 2020, but we were planning a trip to Thailand. A former faculty member was going to lead that trip, and obviously COVID shut that down. So when we were going back to revisit that trip, could we kind of resurrect that trip and get it back up and running? And the funding, I guess there was funding from external that had gone away in 3 years. And so they weren't really able to kind of help me pick up that trip and take it forward. So it is what it is. So EF Tours reached out. They have already kind of a itinerary already pre-planned, but it's certainly, we're working on like swapping days that would have been more clinically relevant, like more nursing related, and like working with my friend Ramon at his foundation and going into the barrios and watching their, community health workers do their work and participate with them. So things like that. We're looking at like the public health, bringing the public health experience to the trip. So, but yeah, all of it's kind of fair game at this point. We're just kind of day by day taking steps forward to see if we can get this trip to happen. So. And Ify, do you have any comments about your CDC connection or what might be possible there?
It depends on what you're trying to do, because I was at the quarantine station, so I don't know, but so those are my connection, and then the zoonosis team, they do like animal importation.
Right.
So those are the 2 connections I have within the CDC.
Okay. Well, I would love to follow up with you after this. So.
Okay, yeah, sounds good.
Awesome. All right. So for the governmental public health experience, we have connections with all the local health departments. And then Jeff Stover, the chief of staff at Virginia Department of Health, is very interested. He's an alumni of ODU. So he's very interested in seeing what we might be able to work out. And then I have connections at Department of Health and Human Services. I have some other connections at CDC. So looking at maybe setting up some field trips or one day kind of site visits to Richmond and to DC, just so students have the opportunity if they'd like to go check those out, as well as locally. So I know we have a lot of students that are all over the state, all over the country, all over the world. And so if we can try to make connections to your local, state, or national public health agencies and entities, we'll certainly try to do that for you. But I think it's important, especially as the public health workforce begins to be redeveloped, because it's suffered a lot in the last 2 decades in terms of budget cuts and just workforce retirements. Not a lot of hiring, not a lot of positions available to hire new graduates. It's starting to build back. Obviously, COVID taught us that, hey, maybe we need to reinvest or invest again in our public health system. So there's a lot more positions that are coming back online, and we want to plug students into those positions as quickly as we can. So think it's important for that in terms of the governmental experience. I know a lot of students struggle around this time trying to find their practicum placements. So we're also looking at potentially offering sort of cohort type projects. So where like maybe 3 to 5 students would work collectively on a project for the Virginia Department of Health or a local health department, or maybe like the ODU Monarch Pantry or something. So where somebody with a global, who's on the global environmental health track, somebody on the epi track, somebody on the health promotion track, you know, the students are working together in a collective sense on a given project. So we are looking to create some of those kind of cohort projects that also would, you know, one cohort end, the next cohort pick up, you know, the following year or whatever, so that we would have some reciprocity of, or continuation of effort. We are, one of the campus-based projects we're looking at starting is a garden, and behind the health sciences building, where all the food that's grown there would go to the ODU Monarch Pantry. So actually the Monarch Pantry proposed a cohort project to us today. So you'll probably be getting an email about that from me for any interested students for the spring. So I think once we start these and they get underway, we will hear from other entities about kind of these one-off projects, or maybe a multi-year project that we have groups of students kind of cycle through and contribute to. So that's something we are looking to expand on and enhance for students, because we know it's hard trying to find a practicum when you feel like you've called and emailed and shown up in 1,000 places and nobody seems to have anything for you.
DDH now has a summer paid internship program. Talk to your buddy Jeff Stover about expanding that to the regular school months.
Right. Yes. So we actually did talk about that at the Virginia Public Health Association meeting last week. And that he's very open. VDH has always been amenable if you find the right director. And so I was speaking with Dr. Walker Harris, who is the office director for the Office of Family Health Services at VDH, kind of about this cohort idea, or just if there are grants that she needs capacity for people to do stuff and doesn't want to hire, say, you know, 5 full-time people, could she throw it to us and, you know, fund students at ODU to do the project? So those conversations I'm having on a daily basis. So I'm hopeful within the next, you know, within this academic year that I'm going to have some really strong opportunities to offer students going forward.
We had an intern, a part of that project at our health department in Stanton.
Yeah.
And she spoke very highly of it. And I mean, of course, a paid internship is better than an unpaid internship, but it sounded like she had a really good experience. And actually that same intern now has a full-time position with us now. So good for job opportunities as well.
Yes. So, I mean, that's the idea, is, in my opinion, is that we're able to pipeline students into jobs and push for students to get paid while they're doing their practicum. That's always, you know, if we can make that happen, you know, then that's certainly what we want to do. You know, sometimes we don't have projects or, you know, research grants to fund the student position, but the experience is still valuable, you know, to put on your resume to say that you did XYZ and had, you know, this type of experience. So I know Sam had sent a couple questions, I think, from some students that weren't able to attend. So I don't want to forget those. I think one of the questions was about the 4+1.
Yeah. Were you guys going to be continuing on the linked program?
Yes.
Okay.
Yes.
And is there like a different future for that?
So we are, so for those not familiar, the 4+1, we have the Bachelor's of Science in Public Health, and we've mapped the classes so that you would add on one more year, like basically the second year of the MPH. So in 5 years, you would graduate with your Bachelor's of Science in Public Health and your Master's of Public Health. So Sam is one of our initial students that went through the program with a lot of bumps in the road. It was not smooth at all. There's basically the substitutions that we need to be able to put into place during that senior year so that they are counting for, both for as meeting the bachelor's requirements and the master's degree. And it's just a way that things are coded. Now that we've done the curriculum changes or standardization, which I'll get to that next subject of why we did that. We are in a much better place to map the 4+1. So that information will probably come out in the spring as we kind of market that to students that are coming into their junior year of the BSPH.
Okay. I think a lot of people want to know about the EVMS merger, like what important info we need to know, and also like what options does that give us students that maybe are graduating with our MPH who maybe want to continue on their education with public health? Because I know that, well, from what I've read, I haven't seen many options for continuation at ODU without the EVMS merger, but maybe I'm wrong.
Yeah, no, nothing has come out yet. We're still in a place of waiting. It has been approved and blessed, and there's a budget. The legislature and the governor have approved the merger. There's a lot that goes into a standalone medical school being absorbed into a public institution. We've had to, in the last several years, standardize our curriculums. We've had to amend our constitution and bylaws as an institution to have matching, policies and procedures, which required 2/3 of the faculty to vote in favor of. So there's operational procedures. There are committees that need to be developed or merged. The good news is that for EVMS, they're bringing over about 600 faculty. There's committed funding for 5 years. No one should lose their job. Now, there might be, if you have 2 of one type of job position, there might be some movement or potentially opportunities to move up or move next to, or, to do something else, but they've made a strong commitment, because it's scary for EVMS, faculty, this is a huge change for them to make sure that we are coming together in the best unified way possible. I think the leadership has done an extraordinary job sort of navigating and managing through all of the sort of awkwardness around it. I believe EVMS is the last standalone medical school in Virginia. So this will kind of end that reign for them. But we are, January 1, 2024 is the launch date. That's when the merger will happen. So effective January 1, the 2 institutions will be together. And the Eastern Virginia Academic Health Center will launch. Under that, there will be 5 schools: School of Medicine, School of Nursing, School of Health Professions, School of Health Sciences, and the School of Public Health. And so the 5 schools will exist under this Academic Health Center. We will have new leadership from EVMS. We currently have a founding dean of the School of Public Health, Dr. Li Wu Chen, who came to us in March from Missouri. So we're building our infrastructure and our capacity of leadership and administration right now. There's been several people hired for associate dean positions from EVMS and Norfolk State. So don't want to forget Norfolk State as a part of this, not the merger, but for the joint School of Public Health. So that, in addition to the merger, ODU, EVMS coming together, we're also partnering with Norfolk State University, who is launching a Master's of Public Health program. Their track will be in health equity. So between the 3 institutions or groups, there will be a total of 7 tracks or concentration areas for the Masters of Public Health. There was a couple overlap programs that we've had to differentiate. So like we had applied epidemiology, EVMS had applied epidemiology. So EVMS is kind of taking the title of applied epidemiology, and we've moved to epidemiology of infectious diseases. It's essentially the same coursework. It's just a different name. So this is all because the State Council of Higher Education in Virginia, also known as SHEV, has to approve all of these curriculum changes. We are in the process, or we've submitted our self-study and all the paperwork and everything to get those approvals. And then parallel to that process is the accreditation through CEF, the Council of Education and Public Health, who accredits our program. We are fully accredited. We will continue to be accredited as an ODU MPH program. That doesn't change. But as we're moving forward, we want the joint school to be accredited. So that's in process now. So all in all, 2025, we're hoping that we will kind of be through all of these logistical and administrative changes and updates and kind of be on the other side for it and have Virginia's first joint school of public health. So, the opportunities I think are going to be incredible once we have this capacity and infrastructure finalized. And, there's talks of creating centers and institutes for different research or innovation projects, and really begin to build our reputation as a national, or global, influencer on public health. So there's a lot. Our faculty is so talented, and that's also something about the experiential learning is how they infuse their research and their knowledge and their expertise into their courses, and trying to get them to be able to do that more as well. So that you kind of see the breadth and the scope of what they've done in their careers, what they're working on, where they want to go, and how we all come together and learn from one another. So getting students involved in research and innovation is a key part of that. Also, Sam, to your point or question about additional or ongoing education, I do think that, how do I want to say this? I think that there will be a lot of openness to students who want to go on to further education with EVMS programs. So hopefully the plan is that, let's say you're a health promotion student at ODU, but there's an elective course that you really want to take at Norfolk State, or there's a course, say you want to take the EPI course under the EVMS ODU/ODU faculty, right? There will be options. There will be the availability to be able to take courses from the other institutions or under other, faculty that have come from EVMS. So we're kind of, hoping that will bring some, cooler flexibility to how students organize their courses and where they end up taking them as a part of that experiential learning. So yeah.
Awesome.
We have the early assurance programs for our undergraduates. That's not necessarily something we've looked at for our master's graduates, but it's maybe something that we could consider.
That's great. I just want to see, does anybody, because we're getting close to our time, does anybody have questions for Dr. Hoglund?
I have another one, then I'll stop talking so someone else can. But I was gonna ask, do you know the reasons for why the data analytics part of the EpiTrack kind of are being removed going forward? Because that was really one of my biggest reasons for coming to ODU, was kind of the combined epi and like biostats side, if you will. And so I'm just wondering if that's like going to be a temporary thing or if it's going to be added back in the future or what.
So that was one of the overlaps in terms of the program. So in order to differentiate our program from EVMS's program, we had to alter some of those courses. Now, still being in the epi of infectious disease track, you have elective courses you need to take. And we will, once January 1 comes, we will be, further discussing, okay, for like, let's say you want to take, which we still offer the advanced classes. But let's say there is a course that we don't offer, but maybe EVMS faculty do. We would work with you to figure out how to fit that in as an elective. So you still get the benefit of the skills that you're looking to learn. There's going to be a lot of, I think, just general flexibility with students because, we had to make a lot of these decisions in order to apply to Chev, right? We can't have duplicate programs. So the biomedical research or biomedical sciences and the MPH were the two programs that both EVMS and ODU have. And so we have, like, I've had to work with my counterpart, Brian. There's a lot of work that was done actually before I assumed this position, but there had to be sort of an alignment on what EVMS faculty will offer and what ODU will offer. So there's no duplication or overlap.
Thanks for the explanation. I appreciate it.
Mm-hmm.
Does anybody else have a question for Dr. Hoglund?
Well, I get a lot of requests for the practicum placement. So I just want to make sure, put a plug out there to make sure that you're consulting with Dr. Kiki and just making sure that you are, taking advantage of any leads that a faculty member might give to you. If they kind of do an introduction or something, go for it, send them the email, make the phone call, offer to meet them for coffee, whatever the case may be, because that could then turn into your practicum experience or even a job. So
when the merger does happen, is there any way, are we gonna have like an up-to-date list of like who our advisors are, or even now, I don't know if they're different?
Yeah, right now, I'm serving as the primary advisor for the program, and I will continue to be that. We will kind of reset probably at the beginning of the next academic year. In terms of like any sort of division of labor or, new advisors or anything like that. That's not going to be a focus for this year. We still have a lot of other things we have to get through. So I'm the point person for the foreseeable future for everybody.
Okay. The last thing, I guess, to close it up is if students had like a concern or a recommendation or anything like that, where is there like a form you guys have for students to like fill out for like, even semi-serious or serious considerations like for you guys that they may have, or should they just reach out to you? Or
yeah, I mean, I prefer you if you just reach out, give me a phone call, send me an email. The bottom of my email signature is a link. You can always schedule an appointment with me, although my schedule right now is really crazy because I have a research project in DC and I'm up there a lot for data collection. But just send me an email. But I think the form is a good idea too. And I'd be happy to set that up just so if somebody wanted to submit something relatively anonymously or whatever, they could do that too. But I there's inevitably with change, there is the opportunity for complaints or, feeling left behind or not informed. And, I take it very seriously to keep all of the students in the program informed as best as I can. So once the merger happens, you'll probably be hearing from me on when those changes are happening. But if you have concerns, about any of the changes, I will be happy to take that forward and upward to those that make the decisions on a lot of these things. I'll be happy to advocate, I guess is what I'm trying to say.
Thank you so much. I just know that a lot of students, I'll hear stuff and I have no problem telling teachers things, and when you do it in a polite way, usually you get answers. But I know a lot of students are scared to say stuff because they think it might affect their grade or something. So I think a form would be a great idea. But thank you so much. Does anybody else have a question before we
Yes.
end?
Yeah, I don't know if you said it earlier and I might have missed it, but for the global health trip, did you say is it likely to happen in 2024 or no?
Yes, we're looking at May of
May. Okay.
2024.
Okay.
Somewhere between May 13th and May 31st is what we're looking at. And it would be from departure date to departure day would be 8 days for the trip.
And
Yeah.
did you get a final decision on where or not yet?
It will most likely be the Dominican Republic as our
Okay.
first trip, since that's seems to be well, one, the most interest has been shown for that trip, and we have more capacity and strength for that right now.
Okay. All right.
Yeah.
Thank you so much.
Yeah, absolutely.
Anybody else?
Don't be shy. What else do you want to know?
Okay, I mean, if we have time, I was going to ask about scholarships in general.
Yeah.
That was mentioned when I applied to the program, that there were certain departmental scholarships that, of course, it sounded like they were pretty limited. But I don't think, like, as a whole cohort, we ever heard anything about the end result of scholarships. I mean, even just bare data points of like how much money, how many people, or anything, or that they had even been awarded. Because I mean, I haven't talked to anybody who has openly said that they have gotten like an academic or merit-based scholarship. So what are the status on scholarships?
Yeah, it's a great question. I think I get an email every day of somebody asking about money. Unfortunately, we don't have committed dollars for scholarships. We used to have money in our budget for graduate assistants. I think when I joined the faculty in January of 2020, I think we had like 3 or 4 GAs at the master's level that were funded and had tuition waivers. But that money was taken and moved to the doctoral level. So the doctoral program, the PhD in health services research, those students are the ones that get the funding for their positions, their GA positions. We are looking actively at funding sources to bring GA positions back to the master's level. That's how we would grant scholarships. We don't have any endowed scholarships or a foundation or anything that's like, to fund anyone outright. That's something we have to build through the Joint School of Public Health. It is on the plan to figure out how to do that. We're just not there yet. So unfortunately, probably won't impact any of you. So I think one small step in the right direction, which Dr. Taylor just reminded me of, was we in the Joint School of Public Health have funding available if you have an approved abstract to the American Public Health Association. If you can get up to 15 support your travel and lodging and a registration for that if you have an approved abstract. But that kind of came about like the last month. So many of you may not have approved abstracts, but something to think about for the spring when abstracts open up again. If you're interested in submitting an abstract, I highly encourage it. And then if you get accepted, then you can apply for these funds to support your travel. So that's one small thing of support. It's probably going to take us a year or 2 or more or longer to figure out our scholarship / GA funding.
I'm just glad that it's being talked about. But I was going to say, if y'all, I mean, I don't know how funding and things like that work, but if y'all can keep in the back of your minds opportunities for part-time students. I know obviously I'm biased because I am a part-time student, but I feel like sometimes like graduate assistantships and things are pretty exclusive to full-time students. And yes, a lot of us are working full-time, but as you saw with me working on your 757 breastfeeds, I always have time for extra things, especially if they're income generating. So I don't know if part-time student opportunities could be a part of that conversation as well in the future.
Yeah, absolutely. I know for sure. It doesn't matter if you're part-time, full-time, you should have an equal opportunity, an equitable opportunity to participate in any funding that's available. Yeah, I mean, and that's kind of my personal commitment. So like if I'm going to get monies from ODU internally, or any kind of funding, I want to be able to pay students, that can participate in my research or participate in a project. I wasn't able, like, for example, I wasn't able to, I had 2 students in the spring that were helping me with my Robert Wood Johnson Foundation project. I wasn't able to pay them, but I like have, with the grant dollars, I was able to fully fund them going to APHA this year, right? So it wasn't a total like money in their pocket, but it was an opportunity professionally to go to the National, Public Health Association's annual meeting, right? So that is something that we're looking to build into the programming, is how do we afford students these opportunities, even if it's not money for tuition or, money in your pocket in terms of pay. Those are important, and we're definitely looking at that, but then also opportunities for experiences that you can take advantage of as well. Yeah, agreed, Taylor.
Yeah.
Sometimes that leads you to the next best thing, right? And then you get a pay increase.
Yeah. Does anybody else have anything before we wrap up? Okay. Well, thank you so much, Dr. Hoagland. I do want to ask before you end with us if you'll stay on when everyone leaves, because I just have 2 quick questions for you.
Yeah, absolutely.
Okay, thank you so much. But if nobody else has any more questions, thank you so much for coming and listening. We really appreciate it. And if you guys can also join us for our next general body meeting, it'll be October 16th at 8 p.m., the Monday, 8 p.m. And then we have our second public health talk, which will be October 30th at 8 p.m. And that is with the connection that Dr. Hoagland gave us for the CPH, is that it? Accreditation. So
Certified in public health.
yeah, so there's a technician like certification like that. So I thought that I was trying to say that because I used to be a technician. So I was just making sure. But yeah, so you guys should totally check that out, because that is something that I know a lot of public health professionals have or want to secure. Like I was saying last time when I interned at the VDH, my preceptor had that, and she only had her bachelor's, but she, heavily, encouraged getting that on top of her bachelor's. So please join us for that as well. And thank you guys so much. We really appreciate it. And we'll put this on YouTube too for anybody that wants to watch it later or wants to show it to somebody.
Thank you all for your time tonight.
Thank you, Dr.
Thank you.
And thank you to the leadership for the PHSA for putting this together.
Thanks.
Absolutely.
I second that, and congrats on your new role, Dr. Hoagland.
Thank
Yeah.
you.
We're all really excited.
Good to see you, Ivy. I don't know if she's still.